If we're looking at infants again, then when we talk about diarrhea, then it would be stools which have a slightly increased frequency or increased fluidity of the stools. In the child who is completely breastfed, then the key is to actually reassure the mother that breastfed babies can have quite loose or even watery, seedy stools, and the infant is otherwise quite well. That means growing well, happy, no abnormal symptoms or signs. Then is to actually reassure the mother that there's actually nothing wrong with this infant with regards to the increased stool frequency or the fluidity of the stool. So from that point of totally breastfed young infants, I would say no need to actually intervene other than just reassurance. Well, I would probably say toddler's diarrhea has a diagnosis on its own, and it's quite common for us to see that in young children between the ages of 2 to 4, and that's why it's called toddler's diarrhea. And this would be slightly loose stools, maybe increased frequency of stools, and the key thing is the presence of undigested particles, food particles, which are classically fruit and vegetable. And that's mainly because the transit time is a little bit faster in these kids. So again, it's reassuring the parents that there's nothing wrong with the kid and establishing that the kid's weight gain has been good. Most parents actually worried that the child has malabsorption. That's why they see slightly loose stools or they see bits of food, undigested food coming out. The key is to reassure them that the child actually is absorbing well and that the child's putting on weight and growing well. And most times parents would understand our explanation and then they wouldn't worry anymore. They can definitely contribute. So basically, the stools are looser and the stools are more frequent because there's a higher water content. And what are some of the things that increase the water content of the stools would be the presence of osmotically active substances, and sugar is a very osmotically active substance. So if they have a lot of refined sugars in their diet, then there's a chance that this might happen. And sometimes it could even be so-called healthy, a healthy substance in the sense that they take a lot of dried fruit or they take a lot of natural fruits or fruit juices. As long as the sugar content, the total net sugar intake is high, then there's a risk of this, what we call osmotic effect. And then the stool content would be much higher in water and the stool frequency and fluidity would then go up.